Knee pain or knee injuries are an extremely common problem that we are able to address with the Sanakey. Now, it's very important to remember that the symptoms of your knee pain and the sensations you feel in the knee when you're bending, when you're stretching, when you're walking, will give you the guide to where you're going to treat with your Sanakey. Just remember, knee pain can arise from soft tissue injuries, ligament sprains and muscle strains, as well as arthritis. Now, all these can be addressed with your Sanakey, even pain that is being referred into your knee from low back pain. So, in short, you can use your Sanakey for knee pain whether you've just injured it, or whether it's a chronic knee pain or post-surgery. So let's revisit the Sanakey settings, all the settings that you have in your device, because we're going to give you recommendations of when to use these. First of all, you have the basic setting, and this is the setting that you immediately see when you turn on. Now, if that's all you use, that's fine. It's always better to change your settings to get the best result. Next, we have sedation. This is a really good setting for acute pain, swelling, and inflammation. So if you have a recent trauma to your knee and you can see that there's fluid in there, or it's swollen and it's hot to touch, this is a great setting to use. Next, we have the activation setting. Now, when you turn the device on, you'll find that you'll need to turn it up a little bit so you can feel it. Activation is a low pulse setting and really good for chronic problems. Once again, just remember, you're going to need to alternate different settings to get the best result out of your Sanakey. Next, harmonization. This is a great setting, a gentle setting, especially if you're using the leads electrode. It's actually in the setting, it's 2 programs, 2 minutes on each, and the whole idea is to leave it or use it for at least 4 minutes at a time. Finally, relaxation. You'll find this particular setting is quite a strong setting. You can feel the intensity of the setting. This is great for muscle pains, muscle tightness. If your knee feels tight when you move, very good treatment setting to use. So let's have a look at which settings to use when you're treating. Now, this is really based on the type of pain and how long you've had the complaint. So first of all, if you've immediately hurt the knee and you have the symptoms of pain with swelling and inflammation, 2 great settings to use are sedation and relaxation. So you can switch between the 2 to get the best result. Next, subacute pain. You don't have the inflammation, it's just a little bit of swelling, but you've still got pain. Great to use basic and the relaxation setting. One of them will always work. So if one works for you, no need to move on to the next one. Next, we're moving into the chronic phase of pain, where you have pain's been with you for 3 weeks, and 2 settings to use: activation and harmonization. Finally, there's often times when you have knee pain and it's not responding to treatment. You've tried all these other settings. A great setting to use now is relaxation, which sort of shakes up the body, and then we balance the treatment with the harmonization setting. Just remember, whenever you use these settings, it should be a comfortable impulse energy on your skin. Remember, these should never hurt you. You should never hurt yourself. And don't treat for too long. Treat for 10 to 20 minutes at a time, and always test. So let's move on to what we need to do in a Sanakey treatment. 3 steps in every Sanakey treatment, no matter where you put the device, is scan, treat, and assess. So what does that mean? Basically, when we scan, we're looking for key points, which are our doorway to the body's pain relief, where you'll find the Sanakey electrode drags, sticks to the skin. The Sanakey impulse, when you hit the spot that needs treatment, the actual impulse will feel quite a bit stronger. And also, when you're dragging the device across, you'll hear the clacking sound get a little bit quieter. So that's the body telling you that is where you need to treat. And finally, you find when you treat, the actual color of the skin on the area that requires treatment goes red, and this is just the blood responding and coming to the area. So this is a very good area to treat. Finally, treating, we brush in 4 directions, or we hold the device stationary, or we change the setting. And finally, you need to assess what you've done. It's no good just doing the treatment and then putting it down and walking away and not knowing what you've done. You need to assess, so whether it be standing or walking around or bending your knee or walking up and down stairs or even squatting. You've got to be happy with the result. And if you're happy with the result, you stop treatment and you treat again the next day. Or, in the afternoon or twice a day, it doesn't matter. But as soon as you're happy with the result, within reason of course, stop the treatment. And if you're not happy with the result, you need to change your setting and start again. So let's look at treatment of the knee, and I'm going to walk you through how to treat. First of all, always select your setting, and we just talked about which settings are useful. But even if you turn the device on, folks, you're still going to get a good result. Secondly, select your impulse level. Remember, it should not be painful. You should feel it, as I say to my patients, comfortably uncomfortable. So what we're going to do there is scan. So we're scanning, looking for key points, which are stickiness of the electrode, where you feel the impulse intensity stronger, sound differences as you drag the device, and skin color changes. So let's have a look at how we do it. Generally, all I do is drag the device along the area as if I'm painting a fence. So I'm doing it in columns, dragging the device top to bottom, finding sticky spots. You can do it 3 or 4 times just to stimulate the area and get the body to respond. Now, once we find those sticky spots, we're going to treat that sticky spot. So we can either do that by brushing the device in 4 directions. In this example, you're seeing top to bottom, bottom to top, right to left, and left to right. And once I find the stickiest direction, so the direction that gives me the most resistance, I'm going to continually work in that direction, and I'm going to keep checking those 4 directions until they're all the same. Now, you don't always have to do that. Another way is just to simply massage the area. Massage the area and find the sticky spot, and you can hold the device stationary on that point, or you can change the settings. Now, usually that's going to take you 10 to 15 minutes. Maybe longer, the better you get more used to the device, and I do encourage you to use the device as often as you can, because as you use it more, the better you're going to be at finding those key points. Now, once we've worked, we now need to assess the treatment. Are you happy with the result? Stand up, walk around, go upstairs, bend your knee, stretch. Is there a difference in the pain? Has the pain moved? If it's moved, you need to treat that area. But if you're not happy with the device, not happy with the result, you need to change the device setting, and you need to go through the whole process of working again. So fairly simple to do. You just need to do it often. The more chronic the problem is, you can treat 2 to 3 times a day. I don't recommend treating more for 10 to 15 minutes at a time. Really, you're going to get bored with it. And so it's best to treat for a short amount of time, achieve the most change in the least amount of time. Now let's move on to those of you that have the electrode head and the pads and leads. These are really good for expanding your treatment, and I'm going to show you how to use those. So say we've brushed the area and we want to use the electrode heads. We're going to remove the electrode heads, so we need to unlock the locking clasp and carefully lift that standard electrode head off, and then we need to fit the electrode back on and lock the head in place. Then we're going to connect the electrode pads to the leads. Now usually you'll have 2 electrode pads the same size, so it doesn't matter whether they're connected to the red or the black. And then what we're going to do is first put an electrode pad on the painful side of your knee, or that area in the knee where it's really sticky, and then you're going to put an electrode pad on the opposite side. So you're putting one on the painful side, one on the opposite side. Make sure they're nice and firm stuck on there, and then you're going to increase your impulse to a comfortable energy level, so you should feel it, and you're just going to treat for 20 to 30 minutes. Important to note that you still need to assess the results. So once you've finished, turn the device off, remove the electrodes, stand up, walk around, check if you've got the result that you want, which is pain relief. Set yourself realistic goals. It's obviously, if you have a chronic knee pain, it's not going to be resolved in 1 or 2 treatments.